audience. Let's have lights up. I can't quite see anyone in the back. I think I see a hand here, although I can't be sure. Let's get a microphone. Just a couple of ground rules. Please identify yourself.
And Jack Hittery.
And short and sweet, please. Your question.
Yes, Jason McKay.
Yes, please.
Regarding easing up government guidelines with smart grid technology.
Yes, sir.
What is being looked into regarding NERC and FERC guidelines?
So, wow, you're really in the weeds on this. So NERC and FERC represent the independent regulatory authorities that have federal role in the areas of smart grid. So the president does not tell independent agencies what to do. And the method by which the smart grid rulemaking is handled on standards is such where the Commerce Department convenes the private sector. We have in the United States a model of voluntary industry-driven consensus standards activities. We can nudge, cheerlead, champion, bring them together, organize a wiki, get them together. So we have achieved consensus recommendations on standards. For example, the one that's been approved already is that how consumer access to energy information should be promulgated using IP as the backbone. Now, those standards are ultimately going to be handled at the state level, where that authority resides. When utilities come to the states and say we'd like to invest money in a program that deploy smart grid technologies, that's a state authority. FERC, the federal commission, does have some ability to acknowledge these standards and engage in a process to certify them. And we're in a process right now where they're evaluating the recommended standards for consideration. But by no means is the federal government looking to take over or remove the authorities that exist. Secretary Chu, when we announced these, said...
And they still call you socialist.
Yeah, well, listen, you live within the... impatient convening is my favorite role of government. Because if you think about it, I was on a homeowners association where I lived in Arlington, Virginia. Like 35 of us had townhomes, and we formed a little association, and we taxed ourselves to like improve the park and to like, make sure we had various services available. And we would have debates about whether we should impose more fees to cover snow removal better. And we just came together in this sort of neighborhood way. And essentially, if you think about what technology and networking is enabling us to do, is go back to that philosophy of neighbors coming together. I came out of Virginia, which is a commonwealth, not a state. We have that neighborly sense. And that's the governing philosophy we're trying to bring in these sort of centralized Washington discussions. It's impatient convening, neighborly, friendly collaboration. You get a lot done. It may not get you all the way there, but it gets you a lot of the way there.
I think the Tocqueville would be very proud. Let's go on to a question over here.
Hey, Aneesh.
And also, can we have the lights up, please? I can't see anything in the audience.
Jack Hittery. Anish, you talk about liberating data, empowering people with applications with that data.
Yes.
When you look at the globe, more than 1 billion people online now in terms of more than 4 billion people in terms of cell phone access, mobile phone access, and most of those, or many of those, don't have the rich application layer. They just have SMS or some basic services. How do you think about this data empowerment, not just for rich applications in terms of web and the kind of stuff we can access with iPads and things like that, but at this very, very basic level of SMS, how do you think about that as you want to translate this globally?
So I'm a disciple of C.K. Prahalad, who unfortunately passed of late, and he wrote a book, Fortune at the Bottom of the Pyramid. And it's really an inspiring notion of this historical divide between federal funding or government funding for aid and development versus laissez-faire. And his challenge was to the private sector, innovate, be entrepreneurial, build profitably at low-cost sectors. So one of my first announcements, again, zero government money, was something called Text for Baby, an entrepreneurial startup called Voxiva in Africa, a US-based startup, went to Africa and provided text message alerts to keep pregnant moms healthy during the term.
Rwanda, right?
Yeah, I don't remember all the countries. I'm assuming it was more than just one.
Yeah.
And it was so successful that a coalition of the cellular phone companies in the US agreed to waive their text message fees to bring back that capability. And we announced this collaboration that basically now we're over 120,000 pregnant moms with a goal to hit 1 million by 2014, I believe. And Johnson & Johnson and others are financing this, zero taxpayer dollars. We're doing some R&D in terms of evaluation models, public health research. And it's a reimportation of a global innovation that might benefit America. And I know it worked because doctors were calling me from Virginia, where I came from, and I did a lot of health IT. And they said, Aneesh, my office is getting people coming in saying, I got an alert saying I need to come in for a prenatal care visit. Thank you, number one. Number two, the president visited India. I had the pleasure of joining him on that trip. And we actually had a two-way video conference where the president in Mumbai, which is an urban center, communicated with a remote village with no indoor plumbing, no infrastructure, but because of India's commitment to breakthrough innovation, WiMAX and a fiber connection to the village center, which is called a panchayat. And I visited this center in September, where the first week they went live with the capability, told the president he needed to communicate with these folks. In 2 months, he heard directly from people who had dramatically improved lives because they had access to this information. So the president signs an India-US open government dialogue. They assign me and Sam Petroda to be responsible. This July, Jack Hittery will be announcing our first portfolio of innovations that speak to that notion of frugal engineering designed in the panchayat level that have the potential for global breakthroughs. I'm doing the same thing in Russia. We're trying to engage around the world. Believe me, this is an opportunity for us to see innovations flourish in all manners of the world. I was talking to learning technology companies, another priority for us. Many reported to me, Jack, their first dollar of revenue came from foreign markets because it's so hard to sell domestically in the US. That's a discussion we can go on to later.
Great. Any last question? We're just about out of time. A quick one here. You may have the last question. Please make it short and sweet. Just hang on a second for the microphone, please. And a quick response from you.
I'll be fast, I promise. I'm just too excited about this stuff, Vijay. It's important stuff.
Hi, I'm Naresh Soni from the wireless industry. One of the impediment I see in healthcare industry is there are a lot of innovative technology in wireless, but a lot of VCs are against funding these innovative technology companies because of FDA regulations, and it takes very long time, and the return on investment is not very clear. What are we doing there?
That is actually, I would make the point, it's quite the exact opposite today. If you follow the money, the problem is not the FDA approval on mobile web apps, okay? That's not at all an issue. I'll happily take that conversation with anybody who brings it up. The problem is reimbursement, okay? Whether or not those capabilities that keep you healthy. Today we have a payment system that focuses on volume. You see a patient, you bill it. You admit them to the hospital, perform surgery, you bill it. If you do some kind of web chat where they don't need to visit you, you've not only you've removed volume and revenue from your equation, you've incurred cost to facilitate that web chat. So it's sort of a double loss. So in today's reimbursement environment, it doesn't make a lot of sense to invest in systems and capabilities that keep people healthy or keep them out of the system. But when we moved, thanks to the Affordable Care Act, a big part of that was to shift the payment system to value over volume through the Medicare Innovation Center. When doctors get paid more money to keep you out of the hospital effectively, that opens up a tremendous opportunity. And don't take my word for it. John Doerr announced publicly the next $1 billion opportunity is taking advantage of this, what he calls this ACO enablement market, which is enabling people that want to keep you healthy. Brian Roberts, considered the leading healthcare venture capitalist from Venrock Capital. I wouldn't call him partisan or political. He wrote an article in Forbes where he said explicitly, health IT has moved from the, quote, backwaters to the front of mind market opportunity because now there's a reimbursement story and a revenue model to justify these investments. So it is not about whether or not it gets technical approval or whether the stuff works or it doesn't. It's always been, will it get paid for? And I'm suggesting to you that now we're in an environment where, because we're shifting the system, it has a much better chance because those tools, those cell phone powered tools, those networking tools are all about reducing the need to come in for a major event because we've monitored and kept you healthy out so you don't have to come back in for that heart surgery or that heart procedure. And that's the thesis in healthcare.
Well, Aneesh, you've managed to connect two of my favorite themes, and those are the Economist. That is the network and the power of technology and innovation with the power of incentives and getting incentives right.
You've got to do both.
And we are out of time, but that was a good note to end on. Please join me in giving him a warm
Thank you.
round of applause. Aneesh Chopra. Thank you very much.